Ever since I was a kid, I've always been into science, loved taking care of people, and I figured what better way to take care of people and apply science than becoming a doctor. So that was a no-brainer for me. My name is Venkat Kalapatapu. I'm a vascular surgeon at Penn Medicine, Heart and Vascular. So the patients that I take care of in vascular surgery usually have problems with blood vessels, in other words, arteries and veins. So it could be, for example, blockages that could cause problems in terms of walking, or could cause stroke if the blockage is in a blood vessel in the neck, or it could be aneurysms where the blood vessels become big, could be varicose veins, could be patients who need dialysis with kidney problems. Wherever there is a problem with blood vessels, I take care of those patients. When they come to see me, they're coming to see a family member who is going to take care of them, because it is not a one-time procedure and then you're done. We take care of patients throughout their lives. It could be just patting them on their back and helping them have a healthy quality of life. It may be doing a minimally invasive treatment, or it could be doing an open surgery. Regardless of what I do, I'll be following them rest of their lives. Penn is at the cutting edge in terms of technology in vascular surgery. So it's fun to be part of that. It's fun to be creative, do new things, and help push the envelope and do better things for the patient.